everyone to our second chat this month for BIPOC Mental Health Month. We are discussing today perinatal mood and anxiety disorders within the BIPOC community. I would like to welcome our panelists. We have Emily Johnson, who is a graduate intern here at Usawa Wellness Services. We have Charity Crawford, a licensed master social worker here at Usawa Wellness Services. And we have Jenny Dalton, who is a licensed clinical social worker and a perinatal mental health certified clinician here. So, good morning, ladies. I hope everybody is doing well.
Good morning.
Hello, hello.
Awesome. So we're choosing to talk about the topic of perinatal mood and anxiety disorders within the BIPOC community, just because, mainly because of the disparities that we have seen are definitely being brought to light in regard to perinatal mood and anxiety disorders, but specifically within the BIPOC community. As we know, maternal mental health is very important, but we are seeing disparities and alarming statistics in regards to undiagnosed mothers within our community. I will start by saying that each one of our panelists have specific or specialized training with perinatal mood and anxiety disorders, and this is like their specific population that they enjoy working with. So I'm really glad that you all took the time to speak today. Just give us a little bit of background on why you chose to work with this population, and I will start with Charity.
Hello. I'm glad to be here. I feel like the perinatal population has a special place in my heart. I've worked with just new mom support groups and just moms in general. And being a mom myself, my own story, which I would love to share some of during our chat, has just placed that population a special place in my heart.
Thank you. Good morning, Jenny.
I'll go next.
Yeah. So I worked with I did hospital social work for a very long time, right? So it's something that has always been, I saw a lot of the disparities just in maternal mental health in general. And just kind of led me to support those families. And then of course I'm also a mom, so my own experiences kind of led to that. And it's just I love watching people grow as parents. I love getting to watch the kiddos grow, but also just that very vulnerable time in their lives. So that's just kind of a little bit of what I guess led me to it, but continues to work with them.
Mm-hmm.
Yeah, I'm Emily. I also chose this population because of my story with becoming a mom and just how vulnerable of a time that is during pregnancy and after, and going through some of my own struggles and watching those around me struggle during this time led me to focus in this area. I also used to work with women and children in particular, and I saw a lot of what happens with undiagnosed perinatal mood and anxiety disorders and how impactful it is on the BIPOC community. And that has really made me want to focus even more on BIPOC community and lower income folks who don't have the same opportunities.
Thank you, ladies. We will go ahead and try to get the conversation started just because it is important. I want to make sure we have enough time to get our thoughts out there. If anybody watching does have a question, just pop it in the chat and I will squeeze it in there at the appropriate time. But I will start the conversation and just ask you ladies, how do perinatal mood and anxiety disorders specifically impact the BIPOC community? Like, how do you see it showing up within the community?
would like to go. I mean, we'll all have a chance, but specifically, I see it a lot here in my treatment with parents. Not only just a lot of trauma resulting from just the medical system, which increases those odds. There are a lot of systemic and racial biases, and so it's a much larger systemic issue, of course. And so the ways that I see it show up specifically in sessions a lot is a lot of trauma, grief and loss, and a lot of depression. So it is where because there are additional issues within the BIPOC community, and the things that are happening just not only outside the perinatal realm, but there are larger and higher risks for these perinatal mood and anxiety disorders showing up in general. So just they're about 3 to 4 times more likely to experience a perinatal mood and anxiety disorder, regardless of what's going on. So they are at a higher population of at risk for these disorders.
Mm-hmm. Yeah, sorry. Okay. I've also seen it show up just in not understanding how PMADs, how they present, and just the lack of education that is out there for PMADs, but it's specifically in how it displays in other cultures and other ethnicities. And I've seen just the confusion and around that.
I agree with what these ladies were saying. And then also I'll say just a lack of access to care among the population. So that means that we're not able to follow up on our doctor's appointments where these screeners are going to be administered. So these things are getting missed. And then also just having that unable to have the financially, lack of the insurance and awareness of programs and resources that are there to kind of supplement where there may be a lacking there financially. So I think that access to care lacking in the BIPOC community is kind of the root to being an issue and exacerbating that being not able to access the resources to address some of those issues. And I think that is one of the greatest factors and one of the greatest challenges we see in BIPOC communities as it relates to disorders.
For sure.
And
it's that access or inability to the access or the inability to receive care or that intervention. So just statistically, they are less likely to receive that care for all of the reasons that you mentioned.
Mm-hmm. What do you think are some cultural factors that I guess influence the experience of PMADs among BIPOC individuals?
I'll say, so when we look at the risk factors in general for just postpartum mood and anxiety disorders, they some of them include not having relationship support, having relationships stress, having childcare stress, having financial stress, racism, having issues having to return to work. So these are some things that are just naturally already occurring in BIPOC communities. And so if these are the risk factors, and then that kind of makes sense, that correlation to why our communities are going to be more likely to be experiencing these. There's cultural factors that just show up culturally already for us. And not to say, like, obviously white Americans also have some of those risk factors as well present, but those are more likely to be more prevalent in our communities. So with those already present, then that is why we see those heightened numbers, because those are naturally occurring already in our community.
Absolutely. And one of the things too of just how it kind of comes out is when, we look further back, and like you mentioned, like racism. So we have to look at the whole system, the whole medical system, different approaches, the bias, the stereotypes, all of the things. So there is that stigma of wanting to receive care and knowing that it's needed, but there are so many issues larger that impact that and impact the access to care. But also, just culturally speaking, we have to look back at when we're looking from a perinatal perspective. We look back to the mothers of gynecology and the just the experimentation and all of the things. So that culturally, medically, within the BIPOC community, there are so many just horrible things. And so that is something to take into consideration as why some members of the BIPOC community are more hesitant to receive that care, even if they have access to it. So that has to be acknowledged within, not only within the BIPOC community, because it's already there, it's already present, but outside of that, within the medical systems, within the providers, all of that. So it has to be acknowledged. And it has to be recognized. So, I mean, I think culturally that's a big part of it too, if that plays into that intergenerational systems that have occurred and what everyone has experienced.
That's I have to piggyback that. I think also there is this, within in Black and Brown communities, we have this idea that we have to be strong, we have to be resilient, because we experience these challenges, and so there's this idea, well, we've been through this, we can get through this, right? But that idea, and just speaking from a Black culture, that's strong Black woman. I don't want to be strong. Like, take that off of me. I don't want to be strong no more. Stop calling me that. I am fragile. Okay. So I think we have these ideas, and then that syndrome, having to the rock. And I have to say also, I have to speak for the dads. Like, dads also have perinatal mood adjustment disorders. Dads, 1 in 10 dads, 1 in 10 dads suffer from postpartum depression, right? But then only 3% of them actually get treatment. So it's the and then perinatal depression, and that makes you more likely to have paternal depression. So I think also we just have this idea that we're resilient, we can do anything, we can overcome, and yes, we have. But honey, like, let's take care of ourselves. We don't have to be right.
Yes.
Yeah. And one more thing to add on all that. Like you said earlier, Jenny, with the just trauma that is experienced beforehand and during birth that can increase your risk for PMADs. Also, just within the, like, more specifically within the Hispanic culture and first generational immigrants also experience pretty high rates of PMADs, and just because of they're more at risk for trauma through the immigration process, and from experiencing wars back in their home country, coming to the United States, and the trauma that they experienced getting here, and then experiencing what they go through at the border. There's just a lot of trauma that is experienced, which raises their risk factors for PMADs. And then also just a lot of immigrants are in the lower income bracket and don't have access to healthcare and go undiagnosed.
Yes. And it depends on where people are also delivering or where they feel comfortable delivering. That kind of adds to that, because in the, specifically, they may not know what is going on specifically, just culturally, they may not know what's going on, that you have to have culturally humble providers that are able to integrate some of those things into the the birth rooms. When we look at loss, we have to look at culturally, what are those practices? So there are a lot of things that not only have they come and experienced trauma and culturally, but once they're in that space, we're often doing more harm. We're just adding to that compounded trauma.
Right. That's a good point. So let me ask you guys this then. How can healthcare providers like better recognize and address PMAD within the BIPOC population?
Oh, there's a list.
Yeah.
There's a list of all the
Definitely
things.
yeah, right. More representation in healthcare. There needs people from the BIPOC community need to walk into a room and feel seen and heard, and see people like that, like from same cultural groups and same ethnicities, so that they feel safe and in that room.
Yeah,
That's very true. There was definitely a study of inclusivity in regards to the training programs, or the lack of inclusivity within the training programs of medical professionals or healthcare professionals in general.
Mm-hmm.
Yeah, a lot of it is that education. Sorry, Charity. A lot of it is just the education too, of like providers needing to educate themselves, not only culturally, but just from a perspective of what is evidence-based, what is, when it comes to, we look at, in mental health specifically, like decolonized mental health care, we have to look at it too from that research perspective. Like a lot of times we put these research studies on, that have been done on a very white population. And so we have to be taken into consideration how that is affecting, because it's not accurate. It's not representative. It's not any of those things. So we have to be able to, as providers, whether it's mental health, medical, we have to be humble and willing to educate ourselves and not expecting members of the BIPOC community to educate us. It has to be, we have to show up and we have to be able to continue that education. And if we need supervision, if we need consultation, like not being too proud to be able to reach out and to do that. And I think another big part of it as providers is we have to listen to our patients. We have to listen to our clients. Specifically perinatal community. There are so many moms that are, and birthing people who are just overlooked and consistently just dismissed. We look specifically at, and of course I can get on my soapbox all day, but like you look specifically for diagnoses like preeclampsia, for example. The signs are shown, way before, and moms are saying, this doesn't feel right, something's wrong. And that's a lot of times how you might, within the BIPOC community, how initially those symptoms present of like postpartum or perinatal depression, specifically of like, I just don't feel like myself. I don't feel right. Something's not right. And so we have to hear our clients, our patients. We have to listen to them. They know their bodies. Promise, they know their bodies. And so it's like, as medical professionals, statistically and facts wise, you may know your stuff, but we also have to take into that component of like, we have to listen and allow those patients to be their care team, be a part of their care team.
That's a good point. So I remember I was reading one of the studies, and I think it's that BIPOC individuals make up under 10% of participants in medical trials. And of course, we understand what medical trials are there for. Like they lead to treatment and pharmacology, like, different medication, different, procedures. So if they're under 10%, then that's a huge disparity in regards to how it can actually help a BIPOC individual. So yeah, I thought that was just very interesting when we talk about what healthcare providers can do. It does start really from educating themselves and also research.
Mm-hmm.
Yep. That's good. I also feel like it's important for healthcare providers to be aware of just kind of the fear and distrust among Black and Brown people as it relates to just the medical care. the research shows that Black and brown folks are 3 times likely to die from a maternity-related complication, and then our babies are also dying at these alarming rates as well. And our bodies are the same, as our white counterparts. There's a lot of different factors. So just there's this fear, right? Well, we have no choice but to go to the doctor. We have no choice but to have our baby delivered, by professionals. But there is this fear that exists, and what you ladies speak about, just making sure that we're providing providers of color, where, and giving that off as an offer. And if we can't, then maybe the nurses and the healthcare staff, having someone on the team who helps just to kind of bridge that gap. Even lactation consultants, just being able to refer these individuals to people where they may feel more comfortable. I know for myself, I had a lack of distrust, of distrust. I was terrified, and then just I had complications and just emergency C-sections, and just there was a lot of fear, a lot of questions about why this happened to me. Also a lot of trauma as a result of my pregnancy and delivery, and there was a lot. So I just left with a lot of questions, just personally, of like, was this related to this? Have this happened to anyone? This happened to me because I'm a woman of color. Did I get the care that I was supposed to receive? So there is a lot of distrust in our communities, and ensuring that providers are aware of that and are able to work within that understanding as well.
Along with distrust, I mean, I think there's also shame involved. I know, I think when I had my second one, I was ready to leave like immediately because of the experience that I had in the hospital, based on what I perceived as bias of Black women. Whether are you really in pain, or just like that bias that was shown. Like I was like, I think I left the next day, or maybe like I think I only stayed one day and a half in the hospital, and I was ready to go, which did not affect me in a negative way, but it could have, based on the experience that I had in the hospital. I will say, I wanted to bring. Yes. Oh, go ahead, Emily. Sorry.
No, I was just going to say really quick too, of like when we were looking at statistically of just not only mistrust and just things of like, it is a clear bias. There's not, evidence-based. So recently, I was looking through some stuff, and there was a statistic that was saying that members of the BIPOC community, specifically Black mothers, with a graduate education with minimum of a master's degree, experienced loss, perinatal loss, but also rates of perinatal mood and anxiety disorders at larger rates than their white counterparts with only a high school education. So it's not about, lack of education, lack of knowledge, lack of ability, right? So it's not something that the individuals themselves are doing. Like, this is not them. That's not a them issue, right? So it's just kind of, we have to be mindful of that too, that it is absolutely, there is bias, there is that component.
So let's talk a little bit about racism in healthcare. I just want to throw some statistics out there. A 2014 study involving 543 internal and family medicine physicians found significant rates of implicit bias. These doctors favored white patients over Black patients and perceived white patients as more cooperative. One 2016 study found that about half of medical students and residents believed at least one racist myth about Black patients, such as the myth that they feel less pain. So we understand how this could affect their treatment of these patients and their ability to correctly identify when a person is in pain or having an emergency. And we've seen this happen more times with people in the spotlight. You know, you hear the story, I think the most recent story of Serena Williams' experience, how, you know, she did not feel heard when she spoke to them about what she was experiencing. And I think like there was clots involved, and, you know, just the idea that a doctor would not believe the patient is just alarming to me, but it is there. It is there.
Mm-hmm. Mm-hmm.
Well, let me ask you this. Given all of that, let's talk more about any unique barriers to accessing mental health care for BIPOC individuals with PMADs. What barriers do we see when we speak with clients, or do we just see out in the community?
Well, I'll speak in terms of just having a partner present, right? So in Black and Brown communities, we're more likely not to have two parents in the home, right? So it starts from there, right? So if someone has a partner there, they're able to take off and be able to go, and someone takes care of the baby. They don't have as much of a challenge with the child care component. So I think it begins that's one of the barriers is being a single parent. And that leads to other issues as far as financial barriers and just being able to take that time off and actually go and seek and provide or get access to treatment that you need.
Mm-hmm. Yeah.
And there's a lot of, go ahead, Emily. Sorry, there was a lag.
Cultural expectations can lead to a lot of barriers. There's still a lot of stigma of mental health in many different communities, but specifically, again, within the Hispanic community, there is a cultural belief that really your coping should be within the family. You should look for family help instead of outside help is a pretty big belief within the Hispanic culture, which leads them to not addressing what's going on, and it, like I said, leads to the place of not being able to get the care that they need.
And I will say too, if, you know, speaking from a familial perspective, depending on, you know, we start with the place of mistrust, first of all. So, you know, other generations, you know, mistrust of medical professionals and things like that. Also acknowledgement of not having, so someone might feel like they need help, and they may not be encouraged or supported to seek help outside of the family or of the community. Additionally, though, we kind of have to look at diagnosis as well, and not to, you know, not pathologizing, but if they're not being screened, if they're not being educated on like, hey, what you're experiencing is not normal. This is not a typical experience. You know, I have moms coming in all the time where they're like, yeah, I realized something was wrong at like 3 weeks, but my doctor was like, this is the baby blues. This is totally normal. This is a total normal experience for you. You know, all moms experience this. All moms are experiencing this, you know, and not having that awareness to recognize like, hey, this is more than something going on that you might expect right after having a baby. I think kind of there's also that disregard too, in not only just in the medical community, but in the BIPOC community specifically, of being dismissed as there being an issue after, for example, after loss, like after a pregnancy loss. That kind of that understanding of like, you can still have a perinatal mood and anxiety disorder. In fact, you're more likely to. And so a lot of times that's not being acknowledged or honored. So we have a lot of clients coming in, just in years of experience, right? Like where that is definitely something that is a theme there of like either misdiagnosed or not appropriately diagnosed, or they've been told like, no, this is totally normal. So they don't know that they need to seek care. And they're kind of, again, being dismissed and not being heard.
That's so good. That's so good, Jenny. With education being a barrier, and having an understanding that the perinatal that stretch is from from conception to a year after giving birth. That is the entirety. You can have a perinatal mood and adjustment disorder show up during that length of time. And just knowing what those signs look like. There's the lack of education in knowing what those signs look like. And for dads specifically, those signs look different than in moms. So for moms, that can look different. For dads, it can look like increased substance use. It can look like irritability, isolation, distracting themselves, playing the game more. So there are things that are showing up symptom-wise. We don't even know what to look out for. And going back again to stigma in the community as it relates to dads specifically, they are, taught to bury those feelings, right? So even if they feel like something is coming up, something is popping up for them, and they don't feel the same as they did before, then they're taught that nope, you're fine, you're good, keep moving through, right? And it's interesting just learning that when I learned that guys, they experience hormonal imbalance as well during the perinatal time period. That's crazy to me. Just thinking about it, it's like, well, you didn't have a baby. How are you getting hormonal imbalance? That is what it shows. So that keeping that in mind and just having that is weird, right? It's like how
Yeah.
but having that education piece to know that and it's constantly that's this constant battle with stigma in minority communities, like and just being comfortable, having that trust, going and seeking care. That trust is, I identify trust as a barrier, right? A continued barrier, the stigma as a continued barrier, right? So even if you do feel like taking it off, I'm not feeling myself, that's a barrier. I don't trust you. I'm not going. And as a stigma, I'm not going. I'm not pushing through, even when you know and you see yourself and your partner not feeling things are out of balance. But yeah, I really, really want to, foot stomp dads. They just don't. I feel like we don't include them in these conversations enough. It's all related. It's interrelated. If mom is off, dad's off. And it also impacts the baby and baby's health and baby's development. So we just want to make sure that we all are taken care of and healthy as well. But yeah, definitely education is definitely a huge barrier.
And I
also think
too, of one of the biggest things, one a bigger piece. Oh, sorry, there was a delay. No, I was just going to say one of the biggest pieces of that as well is having, that focus, and while it is growing, but having that focus of perinatally trained providers within the BIPOC community themselves. We need more providers because there is that lack of trust too of, I'm trained, I'm very educated, very trained. I can help individuals. I don't know their experience, right? And I can't pretend to know their experience. And, so it's very, it is that idea of having and supporting more members of the BIPOC community to have those options so that people do feel more trusting and comfortable coming to those services and getting the help that they need, from this empathetic perspective as well. So it is important. And that's, I think, part of the barrier too.
I also
Another.
think so go ahead, girl.
Go ahead. Okay. I was going to say another huge barrier is just accessing healthcare in general. There was a study, I think it was in 2020, done by Kaiser, that showed in Texas, 3/4 of the BIPOC community, or 3/4 of the uninsured population in Texas are from the BIPOC community, and that is very telling and a very alarming rate of individuals who are not receiving the proper care, or any care, and which just contributes to the cycle of oppression, and it increases risk for many things, but specifically the perinatal mood disorders.
I think a couple of other barriers to keep in mind when you think about postpartum depression or anxiety or perinatal mood and anxiety disorders, it has always had a white face attached to it. And so when you see that, as a person of color, you're not necessarily connecting that this is an experience that you should have or you can have, right? So I think it starts there. And of course, there's been a lot of work to kind of, make sure that all people are seen within the maternal mental health realm. But I also think another thing that contributes to it is moms that I've known, or worked with, there's a fear of shame, judgment, and even the risk of losing your children. And because of just like the idea of if they have some sort of public assistance, then if I go to my case manager or caseworker and let them know that I'm having these thoughts, then what are they going to do? And so that just creates additional stress. And we know that, stress is one of the biggest contributors to PMAD. So it's so many layers, and the complexity of it has to be recognized from the beginning throughout whoever comes in contact with mothers and fathers. I think it's just something all healthcare providers need to be educated on. It doesn't have, of course it can be a specialization, but like education has to be there for every healthcare provider. Do you know, have you guys thought of any strategies that can be implemented to reduce the stigma? Or, is there anything that you guys do with your particular clients in regards to strategies once they come in the door? Because I will say, I think it's more common for people within the BIPOC community to seek therapy before they seek medication first. So like sometimes we are the first arm of support. So what strategies, have you guys used or found helpful?
I just always go back to validation, like validate. Their pain is real. What they're feeling is legit, and and just knowing, really communicating that they are heard and they are seen and they are valued is something that I really drive home. I think that first line of communication or that first line of how you communicate to your client is really important, and hearing that from the beginning, I think is helpful.
Yeah, to kind of piggyback off that, and what I was saying is we keep saying educate, but educating the clients as far as kind of taking that experience of like, okay, this is what happened to you, in the sense of like physiologically, this is what's happening to your body after you are having, after you've had a baby, after, regardless of how that happened. It's very much that education and that empowerment, which does take a lot of validation of like, no, this wasn't something that you imagined. This was absolutely real. This happened. Because there is a lot of hesitancy to call it what it is. You know, some people are afraid to say like, well, this was abusive. This was, I was disregarded. So it does sometimes take an outside person who was not there experiencing what they were in that moment, and to be able to like, okay, reflect back to me if you're comfortable, like what happened, what's been going on, you know, what have your experiences been like? And that's really important to then educate and validate of, yes, this absolutely, yes, this was not okay. You know, along the way, you know, if needed, XYZ failed you. This was something that should have, you know, and we don't want to get into the, you know, this should have happened or could have happened. But part of that is the validation of like, yes, you were dismissed. That's what it sounds like. We're not, you know, necessarily pointing fingers, but it's very much like essentially what happened was not okay. And this experience was valid and real. And it is that piece of it too. So a lot of that education of like, no, this is actually what is expected, and educating them on perinatal mood and anxiety disorder specifically to include birth trauma. You know, and being able to go through it and say like, no, this is actually something. So going through that psychoeducation piece of, you know, what's happening, what did happen, you know, how to kind of from an empowerment perspective. I believe that education and psychoeducation specifically within the mental health capacity is very empowering, because a lot of times there is a lot of stigma. There's a lot of things that are presented as like, oh, it's not real or it's not taken seriously. So being able to go through and say, no, physiologically, this is what's happening in your body, and this is why it's still happening, right? This is more than hormones. This is more than all these other things. This is something that is based on not only possibly the experience that you had during pregnancy and delivery, and also, you know, compounded stressors. And, you know, when we talk about like allostatic load and just the compounding stress, that is something that just kind of builds on that.
That's good. That's everything that you ladies said. Absolutely. And I just kind of want to add on top of what you said, Jenny, about things being minimized. I feel like trauma is minimized, and the impact of trauma as it relates to the perinatal community being minimized, because the trauma impacts the way we parent. That trauma is going to impact our relationship. That trauma is going to impact our desire to have more children. It just impacts, and that trauma can impact anxiety and depression as well, for sure. So I think we just in minority communities minimize trauma so much that we don't allow ourselves to address it, ourselves to be treated as it is present. But another strategy I think that is implemented to help is to just offer that support, just to make sure that they are confident and supported, and that can be done through making sure they're referred to support groups. And support groups are, I feel like, so valuable. Individual therapy, definitely, so that we can have that person to coach and address those individual more deeper needs. But a support group is something that I feel like is definitely needed, because it says like, I'm not alone. I'm not the only one who experienced this. There are other people who are the same stress and trauma as me, or the same disorders, or having the same symptoms or similar things than me. I think sometimes we have this idea that it just happened to me, there's something wrong, or there's some reason that this occurred, right? And so being able to refer to support groups in addition to that individual therapy, I think is something as well that we can help to implement surrounding these challenges.
Absolutely.
I will say, from like a business owner standpoint, I think we have, as far as the strategy goes, I think we have to be intentional about making just the stuff that you even see within the waiting room more diverse and inclusive. I'm often in the community when we do Dottie's deliveries, and I'll go into different birth-related clinics, and there won't be one book about culture. There won't be one book specific for the BIPOC community. And so me as a mental health professional, I am more reluctant to refer a client of mine to a place that does not show intentionality in regards to diversity within their practice. And that's just being completely honest, you know. That is me, but that is something that I've seen within the city and the surrounding areas, is that there is a lack of information or diverse literature within certain waiting rooms. And so if a woman of color does not see someone who looks like her on a pamphlet, again, the connection just may not happen. It tells her like it's not something that will impact you. So why am I here? You know?
Right.
Yeah.
All right. Let me ask you guys this. Because I know we're close to running out of time, and this has been such a good conversation. It could go on for like another hour, because we haven't even like talked about mortality, but we really want to just, you know, kind of get to the preventative stuff. Do you think there are any steps that can be taken to improve awareness, education, or resources regarding just, I guess, like putting what organizations are out there so that we can educate the community?
Like as you mentioned at the beginning, Leslie, we're all trained in postpartum support, have training from Postpartum Support International, which is an amazing organization that provides education and support for the perinatal mental health care. Within that, there is a sister organization within that called the Perinatal Mental Health Alliance for People of Color, and they focus. Yeah, that's it. Yeah. But PSI, the Postpartum Support International, they have online support groups, and it's amazing because you do that right from the comfort of your home. But they have several. I have some listed here. So they have Black Moms Connect. They have perinatal support for Latinx moms. They have single perinatal parent support. They have support for South Asian moms, Black mom loss, and they have a whole slew list of groups for Spanish-speaking individuals. So, honey, they got it all. And the awesome thing is that even if you're uncomfortable and you are, you know, that you have a stigma, and there is a stigma, we know there's a stigma related to healthcare, that is an amazing entry point to begin. You know, if you're battling challenges, any symptoms at all, even if it's trauma. There are so many support groups, and these online support groups through Perinatal Support or Postpartum Support International, they are free. And it is, put the link into. I'm sorry, I don't have the link, but it's Postpartum Support.
I put it in the chat, so it'll show up.
Okay, awesome. And they are not paying us, y'all. It's an amazing organization.
We actually gave the trainings.
Yep. They're fantastic.
$50 every time I say their name. Just kidding.
One of the sorry, go ahead. Oh, sorry. There's just a lag, and I feel like I'm speaking over people, and I don't want to. So one of the things, another one, we have Black Mamas Matter Alliance, Blue Dot Project. Those are some other ones. Some of the bigger, I guess, campaigns, so to speak, too. The CDC has recently I say recently, but granted, there's a lot of work to be done. But the CDC has a campaign called Hear Her campaign. It is generally as from the perinatal perspective. So, but they are doing a lot of concentration within the BIPOC community because of the disparities, because of the mortality rates, and a lot of things that are dismissed or missed because of just the stigma and the bias. So there is the Hear Her campaign through the CDC. There's also one that I provide to my BIPOC clients, specifically when they're pregnant, and let people know within their household, their partners, their support system, whoever. So the Black Birthing Bill of Rights. So it's basically that empowerment perspective of these are your rights. These are your rights. You have that power. And it's just kind of to encourage also, like, say, when something's wrong, you say it. So it goes through and it allows them to be able to provide this also to their providers, their medical providers, and say, like, no, this is what I'm expecting. And so there is like an education, but there is also a lot of organizations do a lot of work with specifically this Bill of Rights. So kind of going from that perspective as well. There's again, I'm trying to think too, there's just national birth equity is another one. And then I think it was the Blue Dot Project. And then, of course, Charity mentioned the Perinatal Mental Health Alliance for People of Color.
And locally, there's the San Antonio Black Doula Collective. They have, and they not only provide support Black families through providing doulas, but they also advocate. They train doulas and provide mentorship. And I was just looking through their website this morning, and they offer a lot of really, really helpful and interesting things to the community.
Awesome. I'm just dropping all the links in the chat for everyone. And we've partnered with the San Antonio Black Doula Collective, and they are a great organization. Which again, it goes to education, because I know when I was pregnant, I didn't even think of having a doula or a midwife. I didn't think that was something, even though from a cultural standpoint, it's just who we are, right? That's like, that should be our first go-to. But I just didn't think that I wasn't educated that, they were here in the community. So I'm glad that we have this conversation and can continue this conversation and have such competent providers within the organizations that want to make sure we are arms of support for all mothers, but especially the ones within the BIPOC community. So I'll open the floor. We have about 5 minutes. If anyone watching has a question, I will go through the chats real quick and look. We definitely have a couple of comments that agreed with you guys as far as the cultural factor. A big one is fear and mistrust in the medical community. The strong mentality is difficult to overcome. That it very much is. A good point of having healthcare providers that look like you, and any provider working with families can benefit and need PMAD training for sure. So again, I want to thank you ladies for joining on. I will also put our information in the comments as we did last week. If you are, someone who could benefit from support, just reach out to us. We do accept all insurances, excluding Medicare, but we do also offer pro bono services and reduced rate services. And that looks like counseling. We have pre and post yoga instruction. And then we are also able to get you set up with the postpartum doula as well. So thank you all for joining in. And we will see you guys next week when we talk about interpersonal relationships within the BIPOC community. So thanks once again. You guys have a great afternoon and weekend.
Bye. Thank you.
Bye.
Bye.